So you have a hernia and you're wondering, do I need to have surgery to get this fixed? My name is Dr. Rich Hills and you're watching my channel, Knife Skills. Today we're gonna try to answer the question, does a hernia require surgery to be repaired? Now, hernias are one of the most common operations performed worldwide. On any top 10 list, you will see hernias right up there. And if I wanted to, I could set up a 24/7 practice just treating hernias and never run out of patients. As a trauma surgeon, hernias are a great part of my elective practice. They provide a nice balance against the stressful, life-saving operations that are performed on a daily basis in trauma and emergency general surgery. It's nice to have an operation that works well, that helps patients and makes them feel great at the end of the day, and hernias fit that bill really well. Of course, it's important to understand what exactly is a hernia anyway. And that's a common question that we'll ask a medical student. We'll ask them, what are the three components of a hernia? And since you're a medical student enthusiast yourself watching my channel, I'll give you the answer that medical students are supposed to say in the operating room. They're supposed to say that a hernia is made up of three components: a hernia defect, a hernia sac, and hernia contents. And therefore, the definition of a hernia is an abnormal protrusion of tissue through an anatomical defect. In almost all cases, with the exception of umbilical hernias in babies, once you have the hernia defect, only surgery can fix that. You see, there are many different types of hernias. And really in this video, I'm going to be talking about inguinal hernias, a subcategory of groin hernias. And inguinal hernias themselves are categorized as direct and indirect hernias, and there are implications for each. And of course, there are many other hernias that you might have. You might have a diaphragmatic hernia, or a hiatus hernia, or a lumbar hernia, or an obturator hernia, or a ventral hernia, or an epigastric hernia, or an umbilical hernia. And each and every one of them has their own natural history and their own appropriate treatment plan. And so it's important that you're talking to your doctor about the type of hernia that you have and get individualized advice. But for people who have a groin hernia and it's not really bothering them, the choice is up to them whether they want to have hernia surgery at all. Now, if you choose not to have hernia surgery, there are some things that can help. Even though they won't cure the hernia, they can make you feel better. Some people find that using a hernia truss helps. It reduces the pain and reduces the amount of bulging that you might be experiencing. Other people find that losing weight, avoiding tobacco, maintaining good physical fitness can all improve the symptoms related to the hernia, even if it's not actually fixing the hernia. Now, if you choose not to have hernia surgery, it's important to understand that there are risks with not having an operation. Hernias can have complications. The most important complication related to a hernia is what we call incarceration. And that is when the hernia contents get stuck through the neck of the hernia and can't be pushed back in. If the blood supply to that hernia content is compromised, we call that strangulated, and that's a medical emergency. You need to have that hernia fixed right away because it could be a life-threatening situation. In other situations, the hernias might grow and become more painful over time. And although not an emergency per se, is a strong indication that you should go ahead and have that hernia repaired. Regardless though, the decision needs to be individualized between you and your surgeon. With any operation that's done on an elective basis for benign things, the benefits of the surgery need to be outweighed against the risks on an individual basis. The risks for a hernia operation are things like pain, the fact that we have to put an implant, there can be nerve injuries, there's time off work, there's maybe financial costs all associated with that. And so you have to know, is that really worth the amount of benefit that I'm getting? If you're not having too many symptoms, then those costs might be too high for you. On the other hand, another individual might be so bothered by the hernias that they'd be willing to do just about anything to have them fixed. And of course, their balance is different. At the end of the day, the decision to have surgery or not is one that needs to be individualized. And I encourage you to talk to your surgeon about your particular case and make an individual decision about whether you should have hernia surgery. Thank you for coming with me along this journey on hernias. If you're interested in learning a bit more about hernia surgery, let's watch this video down below where I talk about hernia meshes, an important treatment tool for many hernias and the benefits and risks associated with them. Once again, thank you for watching and have a great day.